Well, spring is officially here. For some people, it's time of the year to grab a tissue and some nasal spray to try to fight the allergies. But some symptoms are similar to COVID-19. NBC4's Kenya Ramirez talked to a doctor today about how you can distinguish the two. Kenya?
Yeah, Brad, Darlene. Well, last year it was easier to avoid allergy season as we had to spend several months indoors. And this year we have a bit more freedom. So it's important to pay attention to your body and watch out for that pollen count. The flowers are blooming and trees are leafing out. Pollen will soon be everywhere.
This year, however, I think it's going to be tough. I think we're in for a very dry and hot spring and summer.
Dr. Geeta Patel at Premier Allergy and Asthma says her phones are starting to ring off the hook. And this is new in comparison to last year when COVID-19 was fairly new in Columbus.
Spring of 2020, we had a lot going on with COVID, but allergy-wise, it was a very cold spring for us, and so we didn't see a ton of pollen, so we didn't have a lot of patients with allergies.
Now, as more people are alert of COVID-19, seeing people sneezing and coughing can cause some concern. That's why listening to your body is key to figuring out if it's allergies.
With allergies, it's usually going to be pretty seasonal. Patients will have sneezing, runny nose, itchy, watery eyes, things like that.
Or COVID-19 symptoms.
With COVID, you're going to have more severe symptoms, fever, coughing, shortness of breath, kind of that intense fatigue.
The good news, allergies are mostly seasonal, so using nasal spray and over-the-counter medication, she says, like Zyrtec and Claritin can help. But you can also do a few other things to keep them mild, like wearing a mask even when you're outside by yourself.
If you do spend a lot of time outdoors, when you come inside, taking a shower will help. It'll rinse all that pollen off your skin, out of your hair. Keeping windows closed also will help keep the pollen out.
If that doesn't work, Dr. Patel says you may have to try something else.
If it's something that's ongoing and you're like, you know, every spring I notice I always have a runny nose or I'm always tired, it may be worth getting allergy testing done just so you can figure out exactly what your triggers are.
And to read the full list of symptoms, log on to NBC4i.com. Live and local for you in Columbus, Kenya Ramirez, NBC4.
Kenya, thanks so much. Well.